Hello everyone, and welcome to today's webinar, The Canine Connection, Animal Assisted Therapy and OT. My name is Amanda, and I'm the Marketing Manager for AOTA, and I'm going to explain a little bit about how this webinar will work. Today's webinar presentation will conclude with the Q&A portion. You may begin typing your questions in for our presenter at any time during the webinar, but please note that we will only be addressing these questions at the end of the presentation, and we will do our best to address as many questions as time allows. And with that, let me introduce today's presenter, Melissa Winkle. Melissa?
Hello, everybody. Thank you so much for joining me on a holiday for the Canine Connection, Animal Assisted Therapy, and OT. I want to take just a quick minute here to thank AOTA for this member appreciation. I think this is a really big deal that they've offered so much continuing education, especially in such popular practice areas. So let's give them a little hand. Okay, so I do want to dedicate this workshop to Melvin. I just lost him a couple of weeks ago to cancer. He was a huge part of my career and kind of exudes everything animal-assisted therapy. So Melvin, this one's for you. A little bit about myself. I am the president of Dogwood Therapy Services. I am an occupational therapist. This is an occupational therapy private practice in Albuquerque, New Mexico. I'm also president of Animal Assisted Intervention International. This is an international organization for members who are healthcare and human service providers that have animals in practice. I'm also on the Pet Partners Human-Animal Bond Advisory Board. And while it doesn't seem like Pet Partners may be a place for OTs because they only support volunteers and not healthcare professionals, we're going to talk about the role of Pet Partners and occupational therapy throughout this webinar. I'm also adjunct faculty and clinical instructor for a variety of universities internationally. I have 16 years experience in both occupational therapy and assistance dog training and animal assisted therapy. The funny thing is that I have never practiced OT without animals. Even on my level 2 fieldworks, I was fortunate enough that both of those placements allowed me to bring the professionally trained dog into those settings. I'm also the public access educator and coordinator for the Governor's Commission on Disability Task Force. I've authored 5 books in a series called The Professional Applications of Animal Assisted Interventions. Those are on Amazon. I do want to tell you that there is a slide at the very end for resources, and my book names have been put in there inaccurately. Thank goodness. If I'm going to make a mistake on a slide, at least it's on my own book. But they are called the Professional Applications of Animal Assisted Interventions, and they are geared specifically for OT. I also do research and articles on animal-assisted therapy as well as assistance dogs as a form of assistive technology. I provide international workshops, program development, and animal-assisted intervention consulting. And we do post-professional rotations here in my clinic, which means that people who are already occupational therapists come here for a couple of weeks for a continuing education camp. Okay, so let's see what we're doing here today. First, we're going to describe the role of dogs and occupational therapy in the context of volunteer visiting, animal-assisted therapy, and assistance dogs. It's really important that we talk about the core values, principles, and standards of conduct for OT and the application to animal-assisted therapy. We're going to identify 3 different ways for you to include a dog in practice, and we want to outline steps for professional development. So whether you're a novice just getting started saying, hey, what is this animal-assisted therapy business? Or if you've been doing it for years, we're going to start taking a look at some of those professional development standards as they apply to our core values, principles, and standards. We'll also demonstrate at least entry-level animal-assisted therapy intervention planning, and we certainly want to give you a lot of resources for continuing education. It would not appear that there is a lot of continuing education out there, but I've managed to wrangle up a couple for your viewing pleasure. So first, let's describe the role of dogs in occupational therapy, and we'll talk about the volunteer visiting, animal-assisted therapy, and assistance dogs. So you'll see in this diagram, there are quite a few types of animal-assisted interventions. There are animal-assisted activities, animal-assisted therapy, and animal-assisted education. The foundation of all of these is something called animal support. And you're going to learn that this might be you, or this could be somebody that is coming in, bringing in animals to work with you in your practice sessions. So let's talk about volunteer visiting and animal-assisted activities. These are teams, it's usually a human and a dog, that is evaluated and registered to volunteer on a very limited capacity. It's usually recreational or social. There's a lot of therapeutic value, but we have to remember that these volunteer visiting dogs cannot be compared to you as certified occupational therapy assistants or as occupational therapists. You can't compare the two. That's why we have established a partnership with Pet Partners so that we really have that the crossover and the delineation of animal-assisted activities and animal-assisted therapy. So we'll talk a little bit more about that in a couple of minutes. But remember that volunteer visiting is not something that you typically do in your own practice in a paid capacity. So we know that volunteer visiting can enhance the quality of life. There may be no treatment goals, but a lot of our treatment goals might be being supported. Normally the visits are short duration. Most of the volunteer visiting organizations say no visiting more than 2 hours. And this is for an animal welfare type of issue. We want to make sure that the dogs are taken care of. These volunteer visiting animals may have a change in role if they come into your practice with you and your clients when you are the person who is delivering treatment services in an occupational therapy capacity. So now let's talk about animal-assisted therapy. This is all of you. Every person that is listening, this is what you're hoping to do. So animal-assisted therapy, by definition, is directed and delivered by a licensed or degreed healthcare or human service professional within your scope of practice. So this is you at work on the clock with your patients or with your clients. You're working on already pre-established intervention goals such as physical, cognitive, or psychosocial goals. You're documenting and evaluating client the progress and the process. So you have to make sure that you can do your treatment plans accordingly and that things are measurable. And one of the most important pieces to all of this is that your potential participants, your patients, your clients, are very carefully screened for animal-assisted therapy. It's a really tricky place for us to be as occupational therapists. We really want our animals in practice with us, and that's absolutely great. Animals can be a stress relief just by coming to the office. Just having a dog walk down the halls can decrease stress. But it's really, really important that you're keeping in mind just because you like animals does not mean that your clients might. Or if you work in a practice that has numerous therapists, your clients may really like animal-assisted therapy and animals, but there may be other individuals in the clinic who have fear of animals, or there are social or cultural issues in which they really would not have interactions with those animals. Okay, animal-assisted education. This is very similar to animal-assisted therapy. It's directed and delivered by a licensed or degreed educational professional. They're usually working on pre-established educational goals. The process is documented and evaluated just like in OT, and the students are carefully screened here as well. And we're going to talk about why all of these are happening. This is just the general overview. Animal support. Again, I want to emphasize that if you're calling in a volunteer visiting team to come and hang out with you during your sessions, you might be fortunate enough to have a dog handler in your sessions. But for the vast majority of us, we are handling our own dogs. And so this is going to apply to you. If you are taking a dog to work, you, as the animal support person, have these responsibilities. You should be advocating for and supporting your dog during any type of activity, whether it's play or work. And we have to remember that sometimes What we are thinking is play or rest is actually work. So if we've asked the dog to go lie on a mat and we leave the dog there, that dog is still under our direction. We've told it to stay. And so technically that's still work. On the contrary, if we have clients that are just continuously throwing toys or balls for our dogs, that may look like play, but for a dog it may actually be work. So it's really important that you can take perspective of your animals. As an animal support person, it is your job to evaluate the fit of your dog. And if you have an outside handler, that person, you need to evaluate your population, the environment, and the activities that your dog is expected to do. It's really, really critical to make sure that you're using positive reinforcement and handling techniques. We need to ensure that the dog is in good health all the time and that its needs are met, including rest. There are going to be some times that your dog just doesn't want to be working, and dogs need to have a little bit of freedom of choice. We also need to make sure that we're doing some fair scheduling. In some cases, there are dogs that end up working with more than one therapist, and that dog may be scheduled out all day. And we need to remember that while we have domesticated dogs, they still have some pretty primitive needs, going out and laying in the sunshine and bathrooming and, chewing on things and licking themselves and doing all the things that are dog. And it's really important that they have some downtime to do all of those dog things away from patients, away from, a bunch of people coming into the therapy office, and just making sure that they just have some alone time if that's what drives them. Okay, let's talk about assistance dogs a little bit in the role of OT. So an assistance dog within our scope of practice is typically looked at as an assistive technology option. The dogs are individually trained and permanently placed with a person with a disability. The task that a dog performs is specifically geared towards the person's disability. For example, according to the ADA, if an individual is a wheelchair user and they drop items and they are not able to easily get out of their wheelchair and get that item, a dog can be trained to retrieve items, put their paws up on their foot pedals, and drop the item onto their lap tray. So that would be one way that an assistance dog could help. Another way would be, let's say that same person with a physical disability goes to the grocery store, and it's not an automatic door, but there's an automatic paddle that will open the door. Well, typically people put, ashtrays and trash cans and planters underneath those, so the person with a disability doesn't actually have access to it. A dog can be trained to put their paws up and go and push that button with a nose or with a paw so that they're able to enter a community environment. So those are kind of the things that an assistance dog would do. And we, as occupational therapists, specialize in assistive technology and making modifications. So it's not outside of our scope of practice. Once we become educated about assistance dogs and what it takes to work one, it's not outside of our scope of practice to make referrals to legitimate assistance dog training organizations. Okay, these are the flavors of assistance dogs. So if you think of assistance dogs as an umbrella term, there are really only 3 flavors of assistance dogs. One is a guide dog, and this is for individuals who have visual impairments or are totally blind. The dog might find them an empty seat on the bus, avoid the person walking into an open manhole or a construction area. They could demonstrate civil disobedience, especially with all of the great cars we have now that don't make any noise. And, they appear out of nowhere. Dogs have civil disobedience, and the human may want to cross the street, and the dog will refuse to let them cross the street because they can see an oncoming car is coming. Another one is a dog for hearing. And so this is for a person who has a hearing impairment or is totally deaf. And a hearing dog has all kinds of great jobs. They can localize the source of all kinds of noises like the doorbell or a telephone, or let's say a brand new mother can't hear her baby cry in the middle of the night. Or let's say that you and your partner are getting ready for dinner. Your partner is in the garden, and you're inside making dinner. You can hand the dog a fork or a spoon, and the dog will run it out to your partner who is hard of hearing, and that indicates that dinner is ready. So dogs in the service dog category do things other than guide or hearing. So a service dog can serve an individual with physical disabilities. They can be trained for medical response, like diabetes or seizures, and for psychiatric issues, like post-traumatic stress disorder. But they are not emotional support animals. That is a very, very different thing. Emotional support animals are not assistance dogs. We also train dogs for autism. So kind of keep these things separate in your mind. There are assistance dogs, there's animal-assisted therapy, and then there is animal-assisted activities, because you're going to end up having a role in all of those areas if that's the path you so choose to take. So this is one of the most difficult topics for us to talk about, which is the core values of occupational therapy. We have principles and standard conduct, and we need to learn how to apply this to animal-assisted therapy. While we are fortunate that, as far as I can tell, we are the only discipline that actually lists animals at all in our practice framework, caring of animals, which I'm very happy about. We don't actually have a whole lot in here about animal-assisted therapy. And I think it's time that we get together as a group and work towards this and try to make sure that it's legitimate, because animal-assisted therapy doesn't necessarily fit into any of the typical areas of practice that we would do, and it almost fits into complementary and alternative types of treatment, but it doesn't quite fit the definition that that AOTA has listed out for us. So let's look at the core values. Altruism is a concern for welfare of others, so we need to keep that in mind. If we're thinking of taking animals into practice, we've got to look at the welfare of the animals and of the person that we're treating. We have a value of truth, to make sure that we are delivering accurate information, which means we need to understand what it is we're doing in animal-assisted therapy. Prudence, which is the clinical and ethical reasoning skills, making sound judgment, and we need to reflect and make decisions in our professional roles. Is animal-assisted therapy of value to this particular individual, and am I skilled enough to deliver this kind of service? Beneficence. We have to make sure that we are preventing harm and that we are protecting and defending the rights of others. And in this case, again, I want to stress that we need to protect and defend the rights of our animals that are working for us, as well as the rights of our clients. And we need to remove conditions that may cause harm or jeopardize the safety of clients or the dogs in our practice. So some of the conduct standards are that we provide occupational therapy services, including education and training within a level of competence and our scope of practice. So we've really got to make sure that we have the continuing education to support what it is that we say we are delivering. And we need to take steps to ensure that we are proficient, which means when we're looking at continuing education, we really need to make sure that there's a hands-on portion within this. And then once we become proficient, we need to maintain our competency with ongoing continuing education relevant to the practice area of animal-assisted therapy. Non-malfeasance, we have to refrain from actions that cause harm. We have to avoid undue influences that may impair practice and compromise safe and competent services. So one of the undue influences that may impair us is actually taking our animals to work. Just because we think, okay, my dog is really great with my nephew so-and-so, doesn't mean that your dog is going to be really great in your specific occupational therapy capacity. We have to look at the environment, the population, the activities that the dog is, that we hope that they are going to do for us. We have to establish and maintain and update our professional performance, knowledge, and skills. And this is just something that is regularly expected of any occupational therapist in any practice area. So we need to remember that animal-assisted therapy is a specialty area and that there is continuing education in animal-assisted therapy theory as well as application. You know, one of the tricky parts is we have to step back and look and say, okay, well, there's the human-animal bond, and that in and of itself can be a really great delivery method. But if your goals are range of motion or cooking skills or things like that, and you've just got somebody petting your dog or throwing the ball, that may not be fitting what is expected for the outcomes for that client. So looking at the application components and hands-on workshops are really important. We need to know the current research and understand it, because the research that's out there is fairly weak. Very little of it actually applies to OT. There are a number of us that are working to get more research out there. So we need to make sure that you, as practitioners, contribute to the research of animal-assisted therapy. We need to make sure that we have continuing education in animal handling, training, and behavior. And those are three very, very different things. Looking at our dogs and saying, oh, I think my dog is stressed out, or oh, my dog's tail is twitching, he must be stressed out. It's really tricky for us to evaluate our own dogs because we see them in a lot of different contexts, and we assume that they're happy and that they want to do what we're doing and that they'll be comfortable because they are with us. And that's not always true. So we have to care about that animal welfare piece. We have to have proficiency in screening clients for animal-assisted therapy or assistance dogs. And, you know, at the base of all of this, we need to make sure that we're skilled in doing program proposals for animal-assisted therapy, making sure that we can then evaluate our programs, make some improvements, and then further develop those programs that we're implementing. Okay, let's talk about precautions and liability. Okay, this is a really tricky spot. One of the biggest components of animal-assisted therapy is that professional liability coverage. Now, when I had spoken 2 conferences ago to one of the major organizations that provides occupational therapists with insurance, they said that animal-assisted therapy was not covered. So we're really trying to work through this and figure it out, because it is a recognized activity within occupational therapy. There are enough people that are practicing with animal-assisted therapy and enough continuing education workshops and things like that, that it is a legitimate practice area, and therefore we would expect that if it falls within our scope of practice, that it would be covered should something go wrong. But there's a lot of things that can go wrong that the insurance company can't account for. So one of the first things that an insurance company would look for is the state licensure laws for inclusion of animal-assisted therapy. And I'm not aware of any states that actually have animal-assisted therapy written in. If there is, I'd love to hear from you guys. You can send me a personal email. But there isn't anything. But we also don't have anything that says animal-assisted therapy is not recognized by AOTA. If an incident were to happen, if your dog, let's say that you were working in a program that specialized with adolescents with autism. Let's say that you have a kid that had multiple disabilities, and he was so excited to see the dog, he got overstimulated, he reached down, grabbed a fistful of fur, still attached to the dog, so overstimulated he can't let go. Your dog is screaming, you're trying to get his hand done, people are running over to help, which is now causing fear in the dog and the kid, making things worse. Your dog turns around and bites the kid. Here's what the insurance company would say. Okay, so John Doe, tell me again what this dog was doing in your practice. Okay, I get it. And how was this dog trained for this job in this capacity? Now, that's the part that gets tricky, because up until a couple of years ago, there was only things like Pet Partners and TDI and a couple of other organizations. And they screen and educate and evaluate and register volunteers, definitely not for the occupational therapy capacity. So that would not fly with them. They say, okay, well, your dog shouldn't have been there. This is all up to you. Insurance is not going to cover it. But let's say that you have advanced training with your dog. You have continuing education. You can answer all the questions. What was the dog doing there? What's your education in this? How was the dog trained? All of that. Then you're more likely to be covered. Okay. So for professional membership, for some reason the logo didn't show up there, I would encourage you to take a peek at Animal Assisted Intervention International. You can go to that link and see what the membership offers for you. This organization is currently working on an accreditation process, which means that we go through and help you identify and obtain all of the education and things that you need to practice safely, to evaluate your dog, to do treatment planning, all of that kind of stuff. And it's one of those things where an accreditation says, okay, you've got all the background information, education, guidance, and so you go out and obtain all of those things, and then that would satisfy you in bringing, any number of dogs in, because we don't have the business of certifying anybody for anything. That's a very loaded word, and there are very few organizations that are qualified to certify. In order to certify, you have to have a governing body full of peers, and it's usually a university level or things like that. So anyway, you would go through this accreditation process, and then you'd kind of be checked out for yourself and for all future dogs because of your level of expertise in the area. So now let's talk about 3 methods to include a dog in practice. And we're going to outline the steps to get you there. Hold on just a minute. I'm having a little mouse issue. It's back. Okay. So for animal-assisted therapy implementation, there are 3 ways that you can get a dog into your practice, even if you don't have a dog of your own, even if the dog that you love and sleep with every single night is not appropriate. Good for you for recognizing that. So the first way is to contact a registered volunteer visiting human dog team from a reputable organization. I always give the example of Pet Partners. I do serve a position on one of their boards at Pet Partners, and the reason that I am on one of their boards is because I believe in and stand up for their membership categories. They evaluate their dogs frequently. It's not just here, pay me fees every year, and then you and your dog go on your way. The dogs have to be reevaluated every couple of years. Although here in animal-assisted therapy, I would really recommend that people have their dogs reevaluated every single year. But contacting that organization like Pet Partners or any of the other ones that could be appropriate, you can call in a human-animal team to be in your sessions, which is a really great option. The dogs have already been cleared. The people already have great education, and they're there in a visiting capacity, but remember, their role can change if you are directing the session and you have a treatment plan. The other cool thing about them is they come with an insurance policy, and so if anything happens on their part, they're covered for insurance, and from a program development area, that can be fantastic. The second way to get a dog in practice is to evaluate and train your own dog for basic and intermediate skills. This might be contacting a private trainer and having that person come and look at your environment, your practice. Are you in a hospital? Are you in a private practice? Are you in where you just see people one-on-one? Are you in a big clinic with 24 therapists? Because all of those are very, very different. They can look at your population. They can look at the activities that you wish to do, and then they can evaluate your dogs according to that. We have to remember that just because you really, really like pediatrics does not mean your dog is going to really, really like pediatrics. And that's the very hardest part about evaluating and training your own dog. In all of the programs that I go to see, anytime I'm doing workshops around the country, I typically get invitations to other clinics and say, hey, come check out our animal-assisted therapy program. We'd love to have you. And I walk in and the dog is terrified of being in that session because maybe there's sensory equipment or the handler is using choke chains or prong collars and, yelling at the dog, or they're very confused because too many people are talking to the dog, or the dog is overworked, or that particular day the dog is stressed. And so this is why it's really important to make sure that that private trainer comes see what do you do, who do you do it with, and is the dog going to fit the bill for this specific facility. The third way to get a dog into practice is to apply for a professionally trained dog from a reputable training organization. So remember all those assistance dogs I was talking about? Well, just like AOTA, there is an organization for assistance dog trainers called Assistance Dogs International. Now they have some member organizations that train dogs for guide, hearing, and service, but they also train dogs for therapists. So that can be a really great way for you to obtain a dog who is already trained. The dogs typically come in between 1 year and 2 years old. So you skip over all the chewing of the furniture and shoes and all that. And for some of you, you think, yay, that's a great idea. And others are like, oh, I've missed the puppy years. So you're going to have to make a decision with all that. But it can be really great. I would say buyer beware and make sure that the organization that you go through is not sending out dogs that are released because they are having big problems. One time I did see an organization that dismissed a dog from service dog training because it had a fear of shopping carts and thunder and lightning. And then they decided to go ahead and release that dog, but then place it with an occupational therapist who worked in an autism classroom. And so that dog was not successful and ended up not being able to do the job. Okay, stair steps. Let's take a peek at the steps to animal-assisted therapy practice. Well, you're already doing step 1. You are here doing some animal-assisted therapy continuing education. Let's say that you are getting a puppy or working with your existing dog at this point. We want to make sure the first step is that you're working on relationship development, that human-animal bond, get some basic dog training in, continue on with animal-assisted therapy continuing education, begin animal behavior and communication, and that you start getting out into the community to socialize your dog. So that's step 1. Once you have achieved all of those kinds of things, then you're going to move on to step 2. And this is where places like Pet Partners or Therapy Dogs International or any of those kind of organizations become important. I really do recommend that you as a therapist take off your OT hat or your CODA hat and become a volunteer team with your dog. And this is where you're doing some intermediate training. You get to be evaluated. You get to be registered somewhere. You're going to continue to look at animal behavior and communication, doing some, educational workshops, webinars, whatever you can find, which will be listed in the resources. But we want you to really get to know your dog and look at the components that are going to be your dog's strengths and your dog's weaknesses, because when you get out into practice and you're trying to multitask a dog and your patients, it can be pretty tricky. Once you spend 6 months or a year doing volunteer visiting, maybe once a week, then you're going to move into professional membership. You would look at organizations like Animal Assisted Intervention International. You would start working with patients and develop your ongoing animal-assisted therapy skills. You would start doing some advanced topics in dog training if you want to. And the human-animal bond changes here. One of the things that I do with the dogs that I train for therapists or for my own clinic is that I really put a lot of work into making sure that my dogs will work for anybody and not just for me. Can you imagine how it would feel to somebody with depression, low self-esteem, et cetera, and you walk in ready to cheer them up by doing animal-assisted therapy, and the dog is only staring at you and will only move near them if you tell them to. If we are going to empower people, then it's okay for them to talk to our dogs. It's okay for me to say, hey, do you want to do some animal-assisted therapy? Gertrude would love to be in session with you. And if they say yes, then I say, okay, you can say, Gertrude, come. And then Gertrude goes, and I tell them to say yes, and now you can pet her as a reward or give her a treat or whatever that is. So let's look at those details a little more closely. I do want to say before we move on, I'm talking here a lot about training. Make sure that your dog is trained. Well, we have to do that for liability's sake, but it's really important that you don't, oops, sorry, I'm losing some slides here. One of the slides didn't come through. Interesting. That you don't take the dog out of the dog. Don't train the dog out of the dog. For me, in my practice, which is not appropriate for most volunteer visiting organizations, when somebody comes to the door, I have to tell you I have 4 to 5 dogs in my practice at any time, and sometimes I still don't have the right dog. I have a pretty busy practice, and I don't want to overwork my dogs. So thus, here they are taking turns with clients. But each of my dogs gets to pick their caseload, and they tend to be pretty specific about who they're going to work with. And let's say that Gertrude hears the car door of, John, and, John rings the bell to get into the clinic, and Gertie can see his silhouette. She's very excited to see him, and she barks in greeting and, grabs a toy and is happy and romping around, but she's not knocking him over. She's not jumping on him, but she's a little bit vocal. That can be really incredibly powerful. We don't want to train the dog out of the dog. In my specific practice, I have a lot of kids who have had many homes. Some, by the time they're 9 years old, they've been in, 12 foster care homes. And sometimes my dog is the only being that is ever happy to see them. So we want to make sure that you don't train the dog out of the dog. Okay, so let's look in detail at that step 1, the first step. Learn your puppy development. Work on socialization with your neighbors, pet places, and within your neighborhood. Watch for fear. You want to gain observations of your dog. What motivates your dog? Is it toys? Is it food? What are the things that distract your dog? You want to make sure there's supervised interaction and play with other dogs and maybe kids. Make sure that you are within a private or a group training using positive reinforcement. And we want to make sure if you have the opportunity, go and volunteer at a local training organization and see if you can learn a little bit more about positive. We really have to be careful about the equipment that we use on our dogs. If we're talking about the human-animal bond, people are going to see you all the time. Their eyes are always going to be on you. And if we're representing the human-animal bond and relationship development, then why would we be using choke chains and prong collars? Is a dog really trained? If the dog is really trained, would it need to be wearing any of these devices? I would say that this is not a great representation of relationship development, and it can actually turn off caregivers and loved ones of the individuals that you're working with. People will look at your dog and see how you treat them, and they will generalize that to how they think you're going to work with their loved one. I'm not going to play this video, but I gave it its own slide because it is really, really important. After this is over, please take I think it's 2 minutes and 30 seconds to watch this video so that you can gain perspective of dogs in practice, or dogs in everyday life, as the case may be. So now, step 2, becoming a volunteer with your dog. You want to start visiting in a setting that is similar to your own with a similar population. Get to know your dog when you don't have to be responsible for patients. Make sure that you're learning those preferences, fears, distractions, motivators. You can even keep a journal and look for patterns, and then you can share that with the trainer so that you can make training adjustments. Again, your dog is somebody. Don't train the dog out of the dog. You want to make sure that your dog isn't knocking people over or stealing food or medications or any of that kind of stuff, but it's okay for your dog to be happy and wag their tail and make little squeaking noises to greet people. Until it becomes a nuisance and, bothers others or your patients, you've got to really learn how to modulate and determine what is acceptable in your practice setting. Okay, so here's the part that you've been waiting for. This is what you're working up to, that final step, animal-assisted therapy in action. So once you're at this level, you have some additional responsibilities. Your dog should be reliable. It should be predictable, controllable, and it should definitely be polite to people and other dogs. We do need to care about cleanliness standards, but bathing your dog every single week is probably not a good idea. I would check with your groomer or your veterinarian. All of my dogs are dry groomed every single day. That means they're brushed out. I check under their tails to make sure there's no additional passengers. Their ears are cleaned and their teeth are brushed. So the dogs are evaluated every single day. I'm looking for lumps, bumps, scrapes, tender spots, all kinds of things. And then we have to make sure that we can have an evaluation of the dog's skills in the setting with the population and with the activities that the team is expected to work with. So this is really tricky because, again, unless you are a dog trainer and skilled in animal behavior, then you should probably call somebody in because the insurance company would want that anyway. You need to make sure that you have some outside source evaluate your dog and give it a clean bill of behavior. You also want to look at evaluating for things that would take some special consideration. In my clinic, I work with individuals ages 3 to 103. So sometimes we're on the floor. Sometimes there are kids that are running around and squealing, and I got to say, they sound like squeaky toys sometimes. Even looking at the equipment, I have therapy balls and scooter boards and walkers that have tennis balls on the bottom, which is, many dogs' dream. Oh my gosh, this person comes with 2 tennis balls attached to them. And then we have to be able to reevaluate. And this should take place yearly, or if there is any change in population in your setting or the activity level. We have to remember that dogs age considerably faster than we do. Therefore, their preferences can change. Think about your preferences today versus just 5 years ago, 10 years ago. A dog's preferences are going to change. I can remember the day that Melvin told me he didn't want to work with the little itty-bitty kids anymore and that he preferred adolescents. I could tell in his body language, in the way that he greeted the group, et cetera, et cetera. And so it's our responsibility to protect our dogs. We have to respect that range of ability, whether it's in developmental milestones, for the dogs, in the training, their preferences, and their natural drives. If you have a dog that is totally tennis ball driven and you are working in a place where there are a lot of walkers with tennis balls, you've really got to do some evaluation and determine, number one, is it possible to train this highly driven dog to work with this many tennis balls around, or am I just better off getting an additional dog who maybe isn't so driven? We have to advocate on behalf of the dog and make sure that they're still happy with their work. Everybody has bad days. Our dogs are allowed to have bad days. And we have to know when to terminate animal-assisted therapy services if it's no longer conducive to intervention goals. And one thing that I would add in here, because I did this PowerPoint before Melvin died, is that you really do have to prepare for things like bereavement. When Melvin died, that was hard enough on me. The dog was with me 24 hours a day. He was my service dog. He was my partner in crime here in the clinic, and he was at home with me. And, spending 24 hours a day with somebody, there is a very significant relationship. So that was very hard for me. And then when he passed away, I had to retell the story 42 times that week. And closing my clinic wasn't necessarily an option. I was lucky that a colleague was here in town visiting me and licensed here in New Mexico and familiar with my caseload. And so she saw my caseload for the day after he died. But then I had a responsibility to come in and deliver the information and go through a lot of bereavement activities with every one of these dogs. For some of the kids, Melvin was the first person they ever said words to, or that they ever stood up for, or like physically, standing in standers and things like that. For some of my, veteran populations, he had a lot of their secrets, et cetera, et cetera. And so bereavement is one of those things that you really have to, consider. Whew, made it through that. Okay, evaluation of your dog's behavior and evaluation of your handling skills. Or if you're calling in a handler from an organization like PDI or Pet Partners or things like that, We want to make sure that whoever is handling the dog can elicit, reinforce, redirect, or interrupt a behavior with humane methods. In my facility, I don't even allow the word no. Nobody can say the word no to my dogs because people say no with force. No. And that's not how we talk to each other, and that's not how we should be talking to our dogs. But a lot of unpredictable things come up when we're in sessions, so we need to make sure that we can handle all of those kinds of things. Remember that dogs perceive the world through their senses and that they have varied proxemics. They have different personal bubbles. They have different preferences for environments. Some dogs like the quieter environments, and some people really like the action of kids. So now we're going to demonstrate entry-level animal-assisted therapy intervention planning. These are all fantastic pictures of individuals who have benefited from the presence of animals. Some of them are dog trainers, now OTs. Some are kids where I went to the dentist with them and had a dog help them get through that. Some of them are, little old ladies who have had strokes and their goal is to roll out of bed, and so we worked on spooning with a dog. There's all kinds of different things that we can do, so let's go through some of that. When we're talking about the goals that dogs can help us reach, it's really no different than, having kids jump on a trampoline or stacking cones or lifting weights or doing any of those kinds of things. We can really work on range of motion, muscle strength. We can look at spatial concepts. And in a couple of these examples, you're going to be looking at doga, which is doing yoga with dogs. No, we don't twist and conform the dogs into weird positions. We simply have people reach for the dogs or work with the dogs so that they can get their bodies in those positions. We don't ever allow anybody to lie on the dogs or squish them or any of that kind of stuff. But you'll see in the pictures that people are working on body awareness, sensory integration goals, emotional regulation, respiratory capacity, motor and verbal timing. There's all kinds of things. So let's play a couple of games here. I'm going to show you some slides, and you're going to look at them and say, okay, what is this activity facilitating? Is it like range of motion, strength, eye-hand coordination, verbal productivity? Then you're going to figure out, how can I make this easier or harder? Then you're going to figure out, okay, well, how would I measure this? How would I know if I'm making progress doing this activity in animal-assisted therapy with my client? Because remember, you're not reporting what the dog does. You are reporting your client's response to treatment. You're also going to take a look at the precautions, client and dog. What could possibly go wrong? That is the biggest motto. If you have ever come in to my clinic, that is one of the most important things. I will have you walk in a room and say, look around the room, what could possibly go wrong for the dog and the person? And then you have to really look and say, okay, I've got to think like my dog. What do they need to be trained for? Okay, so let's look at downward dog. This is in one of our yoga classes. So what does this activity facilitate? How could you make this easier or harder? Take a peek at all of the pictures because there's some gradations in there. How would you measure this? What could possibly go wrong for the human and for the dog? What does your dog need to be trained for? Okay, let's see how you did. So in that last activity, you can think about upper extremity strength, postural stability, definitely range of motion, plenty of sensory input to the vestibular system, which helps with self-regulation and part of a sensory diet. There's attention span. She had to follow directions. She might have needed right-left discrimination to get her body in that position. So how could we grade it? How could we make it easier or harder? Well, you can see in the picture, in some cases, we have people holding onto a chair. In some cases, legs are straight. In some cases, knees are bent. How do you measure it? Well, it could be quality of movement, distance, duration, number of repetitions, precautions. What could possibly go wrong? Well, this person could fall down on the dog. I have to say every time I get a new client that comes in for DOGA, they start with a stuffed animal or a rolled up towel first. I need to make sure that they will not collapse down on my dog. The other thing I can do is not have my dog be static underneath them. They may get in the position, and then like a human agility course, I may have a dog run underneath them or walk slowly underneath them or whatever the client can handle so that the dog is not at risk of getting hurt. So what does the dog need to be trained for? Well, in this case, the dog is trained for going under and being okay with social pressure. That's what this is. When there is a human that bends over a dog, there is social pressure. And you'll often notice dogs backing up to this because it's kind of, you're pooping up over them and it's uncomfortable. Okay, let's look at one more. Here we have a beautiful elderly lady blowing popcorn across the table to Gertrude, who is sitting on a chair. And then we have a little girl who is blowing popcorn. She is on a scooter board using a straw to blow popcorn and propelling herself across the room. So activities are good for both elderly and younger. What does the activity facilitate? How do you grade it? How do you measure it? What are the precautions? And so you can see here that the therapeutic value might be oral motor skills, respiratory functions, fine motor, gross motor coordination. There's so many great things that we can do when we're doing treatment planning to identify. I mean, all of these activities elicit so many different things that we need and want. So you guys can go through the rest of those slides. I want to make sure I leave enough time for some questions. All of these activities are actually out of my books, which are, again, the Professional Applications of Animal-Assisted Interventions. They're available on Amazon. They were written by me, an OT, specifically for OTs, although other disciplines can use them fairly easily. Here are some resources for you to find some continuing education and some of the documents that I was referring to throughout this webinar. So you can take a peek through here, see where there's some continuing education available for different kinds of things. And there are also some books listed, some online courses like Coursera and Udemy. There's some doggy drawings by Lily Chin that can help you with dog behavior. So the second line down, that book there where it says Theoretical Foundations, sorry, there's my big typo of the day. You can take a peek at any of these other books on animal behavior and things like that. So let's see if I have anything else. Keep your eye out on these folks. They are definitely names in the occupational therapy and animal-assisted therapy world and are a wealth of information. And hey, thanks for listening. We're going to take a couple of questions now. Let me slide my screen over so I can see the whole thing. Okay. So the first one comes from Elizabeth. Hi, Melissa. Thanks for your presentation. I am also a pet partner member as well as an OTR. My concern is having the therapist handling the animal and being responsible for both. If our client's safety is first and the animal also needs attention, how do you attend to both safety at the same time? Would you say that the triangle theory, where a skilled pet partner team is present managing the animal's needs while the OT attends to the client's needs? I think no matter how skilled a practitioner is in animal management, there is always the possibility of unexpected occurring. Do you think partnering with a skilled animal team seems like, and it cuts off there, it doesn't give me any more. So, hi Elizabeth. I will agree that for many therapists, it's a good idea for them to call in a volunteer team to come in and work, but that doesn't come without some problems. We end up with some ethical dilemmas. Number one, I may walk up to you and let's say, Elizabeth, you are my patient. And I can say, hey, Elizabeth, I know that you're here, inpatient, and I know you're really missing your dog. Well, I thought we could do some animal-assisted therapy, and I think that as long as you're willing to let this stranger come in with his dog, we can make that happen. And if you said, no, I don't want a stranger in my session, then I can't offer you the treatment. And there are some big ethical dilemmas for that. So I do think that many therapists can be skilled at handling a dog and a client. Most of our dogs work in practice off-leash and have intermediate to advanced skills. And I have seen many, many therapists do a great job. And again, there are professionally trained dogs out there where the dog, is 95% accurate, and the other 5% of the time you're just giggling because a dog is a dog. So I would say that some people should not and some people should. Okay, Susan says, do you envision certification programs at the community college level for this growing area of therapeutic interventions? Well, again, the word certification is really pretty loaded. The problem comes when you have individuals that have never seen a therapy setting before. They're assuming that because we are therapists, that we are doing couch therapy. Somebody is sitting on a couch telling us what's going on. I find it very hard to believe that anybody could certify anybody unless they understand the dynamics and exactly what every discipline does and what a dog would be required to do or asked to do in those different kinds of sessions. So, we at Animal Assisted Intervention International, we didn't see really a certification program as an answer just because there is no governing body for this area yet. But people can get certificates of participation, and there are some organizations that will certify, and they have their own maybe internal governing bodies. I'm not quite sure. But, I think the most important thing is that any education in animal-assisted therapy is valuable. Even stuff that is not that great teaches you about who you don't want to be. Okay, we're going to move down to, let's see. Oh, somebody asked, do you accept level 2 fieldwork students? Yes, I do accept level 2 fieldwork students. I am currently scheduling into 2018. It's very competitive. There's usually about 10 people for every slot. I think I have one slot this coming spring, January through March or April. So if you're interested, send an email. Okay. Jean, do you need to write a letter of medical necessity for a child that you feel would benefit from having a service dog? No, not necessarily. People can get service dogs without a letter of medical necessity. Some organizations require a note from a physician saying that they